Good afternoon. I'm Dr. Jazz Atwal. I'm the Deputy Chief Provincial Public Health Officer for the province of Manitoba. The current 5-day COVID-19 test positivity rate is 5.1% provincially and 4.9% in Winnipeg. As of 9:30 a.m. today, 127 new cases of the virus have been identified in Manitoba. The total number of lab-confirmed cases in Manitoba is 35,815. We have seen case numbers start to increase in the past several days. We've been keeping a close eye on them, and we don't like what we're starting to see. Our test positivity rate has gone up nearly 2% in the last 2 weeks, and we're starting to see higher numbers of cases in people in their teens, 20s, 30s, and 40s. While fewer people are going to hospital at the present time, more of them require intensive care unit use. Our contact tracers are reporting people are holding larger group gatherings and house parties, play dates, sleepovers, and a lot more interactions with people from other households. It is easy to see how this happens because we can go to church, people feel like we should be able to have brunch together. Because kids can go to dance class, we feel like they should be able to get together after class. But this does not align to the orders, and it creates a higher risk of transmission. And the risks are not the same. The orders are in place to ensure we have some essential services open while balancing that with higher risk activities. They are meant to allow us to continue to live our lives to some extent while still keeping COVID-19 at bay. But we only have to look to the provinces on either side of us to see the impacts of the third wave. We've been in this place before. We can see what is coming. The goal of public health is to provide advice to the public on what steps they can do to reduce risk. We don't want to have to introduce public health measures, but we are working on finalizing our plans and will be sharing information on any new restrictions in the coming days. What we introduce will depend on the numbers that we're seeing and the epidemiology of the cases over the next short period of time. But in the meantime, we ask you that you do your part to follow the current orders, limit your close contacts, stay home as much as possible, and help keep your fellow Manitobans safe. Variants of concern are quickly taking hold in Manitoba. They have been found in every health region in the province. This is concerning as variants spread more easily. We have a handful of B1351 variant cases first identified in South Africa, and yesterday we identified the first Manitoba case of the P1 variant that was first identified in Brazil. We're already beginning to see the effects of the B117 strain. It is quickly becoming the dominant strain in Manitoba. Variants of concern made up nearly 40% of new cases in the Winnipeg health region between April 1 and April 7. In Winnipeg in the past week, cases doubled and more than doubled in people under the age of 50. Nearly a third of all clusters of COVID-19 identified in Winnipeg are related to a variant of concern. And we're on track to seeing the number of cases due to a variant of concern double in the next 10 days. We're also seeing evidence that people are gathering in larger groups. We've heard of events where 2 neighbors have had 10 people each on their property for essentially the same gathering. In the past 7 days, the mean and median number of contacts to a case has also increased. This means more people are reporting higher numbers of contacts. We do know that there can be extenuating circumstances when the number of close contacts is high. The person may come from a large household or have close contact with a large number of people in an essential workplace. But if everyone has this many close contacts, the third wave will be severe. I want to be very clear today. The third wave is starting. And like Dr. Roussin said Monday, how hard it hits us is going to be up to all of us. Indoor gatherings are still our main source of transmission. We all need to do as much as possible to reduce our close contacts. This means avoiding closed-in and crowded places and close contact with others. It means staying home as much as possible, especially if you're not feeling well. And it means practicing good physical distancing as much as possible. Throughout the pandemic, we have seen a number of workplace clusters. Working from home is one way to reduce that risk. If you can work from home, now is a good time to make that move. This will reduce your close contacts and help reduce the spread of the virus. We know the variants are more contagious, and we know that staying home as much as possible will help reduce the spread of COVID-19. So if you can work from home, we suggest you do. We are seeing many situations where people are traveling for non-essential reasons. People are traveling to gather with friends and families. Then they come home with a nasty souvenir from their travels, COVID-19. We are aware of cluster of cases linked to the B.1.1.7 variant of concern that has led to some severe illness. One individual got infected related to non-essential travel. This led to the infection of several others, including household members and some of their close contacts. There are 6 linked cases to this, with at least 1 in the intensive care unit, and dozens of others who are close contacts of the people who have tested positive, who are presently in self-isolation because they have been exposed. The P1 variant also arrived in the province through non-essential travel. Travelers must self-isolate. The province next to us are both seeing very high cases with many VOCs. The only way we prevent this from spreading in Manitoba or to Manitoba is doing our part, self-isolating and getting tested when we arrive in the province. There will be many students returning home from school in other provinces who also risk bringing COVID home with them. Self-isolating and getting tested is how you will keep your family and neighbors safe. Leisure or non-leisure travel or non-essential travel could have grave impacts for your family and for your neighbors. Now is not the time to be leaving Manitoba if you don't have to. So unless there is an essential reason to travel, just don't. Just stay at home. The variants of concern are also impacting schools. As they become the dominant strain of COVID-19 in Manitoba, the value of screening and sequencing for specific variants becomes less important in all sectors because soon the majority of COVID-19 cases will be related to the variant of concern. That's why the province has taken steps to strengthen the case management and self-isolation protocols both for the public and for schools. This means our frontline public health officials are providing the advice needed to help reduce the spread of COVID-19. However, the Education COVID-19 dashboard will continue to show if a case is related to a variant of concern, and we will continue to note if an exposure is linked to a variant of concern. Following the fundamentals remains key to help fight against COVID-19 and the variants of concern. Don't underestimate the power of staying home when you are sick. Avoid crowded places, closed spaces, and close contact settings. Practice physical distancing as much as possible. Wash your hands, cover your cough, and use hand sanitizer regularly. Before I close, I'd like to confirm that an audit to review compliance with Manitoba's vaccine eligibility guidelines has been completed. The audit found some instances of healthcare workers who had likely received their dose of vaccine slightly in advance of their age bracket. However, none of these instances were identified as being blatant attempts to jump the vaccination queue, and no further action will be taken. The audit process has now concluded, and the emergency order will not be renewed. All healthcare workers are encouraged to make their vaccine appointment as soon as they are eligible. I want to thank them all for their ongoing efforts to support patient and client care across the province. I can now take questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CTV Winnipeg, Jeff.
Well, hi, Dr. Atwal. I'm just wondering, Ontario is asking for help. Has Manitoba received that ask? Has Manitoba do anything to help Ontario?
I believe that request, it doesn't go through public health. I believe a request was made by the province of Ontario to Shared Health. I don't have the details of that request.
Okay, thank you. And I have a follow-up here. I'm just wondering, I have a question about trade shows. Are people involved in those required to self-isolate? What sort of enforcement will the province do if people do fail to self-isolate? And is the province concerned about these events spreading the virus?
Yeah, so when we look at these markets that are set up, they are set up as retail markets, so they do have capacity limits. I believe you're referring to the issue with Third and Bird that we were advised of this morning. Anyone coming into the province who is not providing essential work to Manitobans has to self-isolate for 14 days. So that's very clear. So if you are coming in to, let's say, sell goods, essentially you aren't exempt from the self-isolation order. So I believe all that has been cleared up with Third and Bird and other markets as well. So these markets in general, just to kind of take a step back, are treated like retail. So they do have capacity limits and they are monitored by public health investigators. We meet with organizers related to this on a regular basis and ensure that everyone is aware of what the orders entail and what they are required to do from the orders perspective as well.
From CityNews, Mike.
Good afternoon, Dr. Atwal. Just another question on Third and Bird. We've had local artists and vendors tell us that no craft shows that they've wanted to go to have been able to go ahead this year, but Third and Bird is obviously on at the same time that we're saying, the variants of concern are an issue. Can you explain why this specific craft show has been allowed to continue?
Yeah, a lot of these requests come through our stakeholder relations unit, and we review them with public health and with people who interpret the orders, essentially legal counsel, and we look to see where something might fall underneath the orders. If something is considered more of an event, that isn't specifically retail, but there's a lot of other things happening there, like concerts, etc., obviously those things can happen. So it's not a broad brushstroke on all of these things, but they are reviewed individually to see if they would meet the order to be available to occur. So again, we obviously look at the orders on a regular basis, and it sounds like there might be some confusion here with some individuals, so we'll look to see if we could provide some clarity in the future as well. But our stakeholders relation unit is actively involved with all of these situations.
And then just jumping topics, with firefighters and police getting the prioritization on vaccines now, can you just talk a little bit about that decision? I know Dr. Reimer was asked this earlier today, but can you just explain the decision and what Macy's recommendations may have been?
The vaccine task force and Dr. Reimer, lead that discussion, and I think they're the best people to answer that question. I know that we are prioritizing peace officers and firefighters, and we're looking at postal codes for individuals who work in certain geographic high-risk areas and those who live in those areas as well. We're sort of finalizing a lot of those details. They haven't been finalized yet. I'm a part of that group and that working group as well, so there's still ongoing discussions related to how that will operationalize, how it will look, who's included, and we'll have better information on that and something that's really ready for the public probably mid next week, so the next time Dr. Reimer is out on next Wednesday, I believe.
From the Winnipeg Free Press, Katie.
Good afternoon, Dr. Atwal. Can you just clarify, can we expect to hear more details about the new restrictions next Wednesday, or why wait to implement new restrictions?
Yeah, so we're reviewing the orders right now. We're reviewing potentially what the orders may look like. Do we keep everything the same? Do we add in some restrictions? What that might entail? We're actively looking at our case numbers. We're actively looking at the epidemiology of our cases. And we're going to gather a little bit more information in relation to that. So as we gather more information, as we come to a better point in decision making, that information will be provided to the public. And I believe early next week will be a point in time where we'll be able to present things to the public. I do advise Manitobans. I mean, this is where Manitobans need to step up and really step up and ensure that they follow not only the orders, but the spirit of the orders to limit those interactions. You could very well see what's happening in Ontario. They have this third wave that's going to impact the entire province, not just for weeks. It'll be many, many weeks that'll have an impact on canceled surgeries, on the inability to open up sectors in society. We've been there. We were there for a period of time. we actually never got back to getting all those surgeries done. There's still a small percentage of our surgical slates that didn't get back up and running. So we are cognizant of the impacts on the acute care system, and we just can't go back there. So I'm encouraging all Manitobans to really limit your interactions, really follow the orders, follow the spirit of the order, and really limit your ability to contract COVID-19. Key thing here is also, if you are sick, stay at home. Your household should stay at home until you get tested and that test result comes back. We've heard other stories of individuals who are sick for a week, still sending their kids to school, finally getting tested as a parent and it's positive, and then, those kids obviously become cases as well in that situation, and that's impacting 20 families. So the message is there. We've been messaging the same thing for a year. The next few weeks is very critical. So I think it's very important that all Manitobans listen to the messaging, follow the orders, follow the spirit of the orders, and really restrict those interactions.
Thank you for that. Can you give us more detail on the P1 case, P1 variant that was detected here in Manitoba? Any specific details about how that was contracted and the condition of the individual?
The P1 variant that was discovered in Manitoba was an individual who was exposed out of province and developed symptoms out of province, came back into the province and did exactly what they were supposed to do. So there is no risk to other Manitobans. They had one close contact in Manitoba as well. So we might see another case as a result of this travel from non-essential reasons, and it would be a household member contact as well. So from a public health perspective, again, we're monitoring that situation. We feel that the individual did exactly what they were supposed to do, and the risk to other Manitobans from this case is non-existent. The biggest risk to Manitobans is, leaving the province and coming back, or having people come in from out of province and not self-isolating properly. That's the lesson to be learned here. So avoid all non-essential travel, period.
From Global News, Marnie.
Good afternoon, Dr. Atwal. Just on that note, you mentioned just with the P1 variant here and rising variant numbers, would we potentially look at introducing more travel restrictions to stop people from coming in out of province?
Right. There is nothing that's off the table here. We are looking at risk. Obviously, travel is how these variants came in. We do have some of the strictest measures in the country at a provincial level related to travel restrictions already. We are looking at that risk on an ongoing basis, and any tool we have we'll utilize if we think it'll be effective. So we're going to continue to look at that. I don't have any definitive answers for you right now, and when something is available, we will provide that back to the population.
Okay, thank you for that. And I just want to go back to the third and bird topic. Even if an event is approved by public health, should events like this be inviting out-of-province businesses here, especially while we're entering this third wave?
Yeah, again, this wasn't considered an event. We haven't approved events, period. This was considered a market, and it was being treated as retail. They had put caps on that at 30% compared to 50% within the orders. They had sold tickets as well to make sure that there was a limited number of people within the venue at any given time. So they took the orders and they fine-tuned them and actually made them a little bit stronger to host or manage this retail outing that was occurring. Again, they still have to follow those orders. So anyone coming into Manitoba basically has to self-isolate. Really, there are no exemptions. The exemptions are far and few in between, and those are specifically dealt via public health. So there would be no exemptions granted in this situation. So again, we will reach out to other stakeholders and others involved in these processes to make sure that is crystal clear. And again, we might have to look at the orders to address some of this as well.
From the Brandon Sun, Kim.
Good afternoon, Dr. Atwal. My first question is, why did the province make the vaccine update announcement during a town hall meeting last night and not today?
That I'm not 100% sure. I think we're trying to get information out to the public as quickly as possible. So I would assume that is what it was related to. I think that would be a good question to ask the vaccine task force as well, just to get clarification.
Okay, thank you. My second question is, what have the impacts of fake news been in the fight against COVID, and how do you convince people of the truth when they seem wholly convinced that the fake news is correct?
You know, this is something we've dealt with all through the pandemic. I think people should open their eyes. You know, we have in Ontario, if you see what's happening in Ontario, they have roughly 700 people in the ICU. That number will climb. When we had, dozens of individuals in our ICU and hundreds of people in our hospitals here in Manitoba during the second wave, those aren't make-believe individuals. Those are brothers, their fathers, their daughters, their mothers, there's cousins, there's uncles. There are plenty of individuals out there who are just general people walking around in normal life who contracted a virus where they were significantly impacted by it. When we're looking at evidence from around the world, we have evidence from around the world. We have scientists from all around the world who discuss the impacts of COVID-19. We have visuals all around the world. You, as someone in Manitoba who lives in a home, may not see a hospital or what it looks like inside. We provided that footage for people to show you the impacts of COVID-19. COVID-19 is real. The variants are real. The variants are more impactful. They are more impactful to the acute care system than the original strain of, or the wild strain of COVID-19. We have evidence from other jurisdictions that if you're in your 20s with the wild strain of COVID-19, you had a 0.2 risk of being in hospital. That's low. With the UK variant, that number goes to 1.4%. That's a 7-fold increase. And that is there at every decade. Not that same level, but that same higher risk. So the UK variant is what we're predominantly seeing here in Manitoba. It's what's taken over in other provinces as well. I'm not too sure how much clearer we could make it from a public health perspective on the realness of COVID-19 and the impacts on the system. We've had to transition hundreds, maybe thousands of workers from one part of acute care to another part of acute care to manage COVID-19 in hospitalized individuals, in those in the ICU. Talk to those who had to get their knee replacement postponed, their hernia repair postponed, cardiac surgery waits. You know, these are all real things that are happening in Manitoba right now. And it's all because COVID-19 is having that impact on the acute care system and will continue to do so. So this is why the really strong messaging is here. This is why we have those measures in place. We know what happens with measures. The stricter the measures they get, the less transmission of the virus there is. We don't want to go down the road of Ontario. You know, our third wave is starting. We can make this third wave plateau. And we recognize we're not going to get to 0 cases, but we want to be able to manage our cases. The acute care system needs to manage those cases. People still need other aspects of healthcare to help them out. So I really want Manitobans to seek out really important, good information from trusted individuals. You know, don't go on Twitter and read the first thing that comes up. Don't Google one word and read the first thing that comes up. Go to health professionals who have trained years and years to learn what they are telling you about COVID-19. And I think that's the most important thing that people need to realize. Again, look at your neighbors, talk to your neighbors. Everyone probably can tell you a story now about how COVID-19 has impacted them, indirectly or indirectly. So seek out the truth, seek out that information.
From CJOB, Clay.
Good afternoon, Doctor. It was mentioned earlier this week that possibly because the case counts are going up, Dr. Roussin indicated one of the things that could be brought in, mandatory mask use outside. We talked to some people, you know, just going down the street in downtown Winnipeg yesterday, asked them about that. They didn't have a problem with it. They were just wondering how it would be enforced. Any thoughts on that?
Yeah, I mean, obviously the orders haven't changed right now. Again, we're looking at everything, all the tools that we have that are available to us to look at mitigating risk, to reduce that risk of contracting COVID-19. So again, we're looking at everything on the table. We're going to look at all of the tools that we have. So I don't have a specific answer for you right now, obviously, because that order doesn't exist. We're going to continue to look at the evidence supporting that, and whether that actually happens or not, or is a recommendation by public health, is something that hasn't come to bear yet. We are still going to review the evidence there. We're going to look at other measures as well to see what we can and can't do to help prevent the spread of COVID-19.
Okay. Quick follow-up. We got a call from a listener this morning. He feels that there's some confusion on the age eligibility. She's 56, and she's been waiting for her age number to come up. But she got a call from her Safeway pharmacy yesterday saying if she is 55 or older, she can now book an appointment. She said she follows the province website faithfully. She hasn't seen anything on that. Is there some confusion that 55 or older can now book an appointment at the pharmacy, at the Safeway, Sobeys, or some other supermarket? I said I would look into it.
Vaccine eligibility is available online. I believe it's 57 for Manitobans and 37 if you're First Nations. Those are for accessing the Moderna and let's say the Pfizer product at the super sites or pop-up sites. The AZ vaccine is available for those 55 to 64, if they have an underlying, let's say, health condition, a priority listing one condition or two condition. So I don't know the underlying health condition of this individual. Do they have one of those conditions? Their pharmacist would know, their medical provider would know. So if they fall into one of those categories, they would be availed to getting that vaccine as well. So there's a little of information here that we don't have, but it sounds like, if the pharmacist did call this individual, that they likely fit into one of the categories for that AZ vaccine.
From the Winnipeg Sun, Scott.
Hi, good afternoon, Dr. Atwal. You talk about all the evidence that we have, what we're seeing in other provinces. There's urgency in your voice today. There's no new orders coming this week. I mean, Dr. Rusin talked about that potentially being the case earlier. Why did that change? What did you see in the epidemiological data to not institute tougher restrictions this week?
Yeah, we're reviewing the data. We review it every day. Obviously, our case numbers, 2 weeks ago, let's say they're averaging on a 7-day rolling average, 75 to 80 cases in Manitoba per day. We're averaging roughly just over 130 on a 7-day rolling average right now. We're looking at the underlying epidemiology of the cases, so there's still some data that has to be analyzed. We're seeing a lot of household transmission in younger individuals as well. So we're just trying to get a better grasp of that data and a better understanding of what we can do from an orders perspective to mitigate risk, to be very strategic here. Again, we don't want to put a whole bunch of restrictions on Manitobans. We don't want to go back to shutting everything down, and we want to be very cognizant of the impacts of that. And that is a last resort. So we are looking to see what we can fine-tune. We're hoping these numbers don't escalate. We're going to look at, again, the numbers over the next few days and see where those numbers go, see the impacts on the acute care system coupled with those numbers, look at enforcement. We do have enforcement out more and more right now. We have public health investigators out. We are knocking on doors. We're knocking on retail doors. We're knocking on private residences to make sure that people are doing what they should be doing from a case and contact perspective as well. So there's going to be a greater presence. So we've already, maneuvered there as well. So again, we're going to look at those numbers. We're going to understand the epidemiology a little bit better. We have some ideas of what we want to look at doing, but we're comfortable right now just waiting to see where our case numbers go before we either implement what we're thinking of doing or fine-tuning it a little bit more depending on those numbers and the epidemiology.
Thanks for that. I guess the follow-up is, we've seen it spiral out of control in Ontario. They waited and didn't do enough early on to to stop it. I guess why are we inviting that sort of thing to happen here by waiting longer?
Yeah, so again, we have to balance risk here. We are encouraging, we are messaging, we're strongly messaging to Manitobans. I think, we want to be very clear. This is up to Manitobans. Manitobans have to step up. If they have been stepping up, those who haven't been stepping up, make sure they step up. It's going to be incumbent upon all of us, again, to make sure that we don't lock down. That's not our goal. Our goal is to have somewhat of a functioning society where people can still partake in some activities. It's good for your mental health. Again, the option of last resort is really to lock down to that degree. Ontario, when you look at how the case numbers went up, they likely waited much too long. And we're not going to go down that road. I could assure you that. We want to see what we can maintain with the restrictions that are in place, and likely fine-tune those restrictions to mitigate that potential of increased cases or generating a large third wave. We want to kind of see this plateau, and it seems to, from a case perspective, numbers perspective, plateaued the last few days, and we're comfortable, I think, with this number. Obviously, we'd like to see it lower, but if we could maintain this and get it a little bit lower, I think we're comfortable with the way we are. But again, we will be monitoring that over the next several days.
From CBC Manitoba, Bart.
Yeah, more along that line, Dr. Atwal. Back in the fall, the province attempted incremental restriction application in October and November when the growth curve, the geometric growth curve, was very similar to what it is right now. Granted, it was a little bit higher, a little bit steeper, but it was higher. Dr. Rousseau acknowledged after, probably should have locked down hard and fast first. We've seen the effects of locking down hard and fast in the Maritime. So I got to ask you, what makes you think what you just described as strategic restrictions, what makes you think that will work this time?
Well, the fall time is a little bit better, different than the summertime or the springtime. There's less opportunity for those in the fall time to do outdoor things. In the summer or springtime, it's a little bit different. We're in a bit of a unique circumstance where we had restrictions in place for a long period of time, greater restrictions even in the sectors that are open than was happening in the fall. So that does limit that transmission. So it's not an apples to apples comparison. It's similar, but it's still not apples to apples. So again, we are going to take a look at all of those variables, those indicators. We're going to look at what happens from our case and contact management and gather that information and see where that takes us. And again, we are going to look at the orders. We are looking at the orders, and we're going to see what we need to do to mitigate that risk even further.
Thank you very much for that. Different question, and just following up on what Marnie asked. We saw during Manitoba's very small first wave, information checkpoints at interprovincial borders on Highway 1 and Highway 16. Since you have admonished people, not just you, but you, Dr. Rousseau, so much for non-essential travel, why won't the province just do the bare minimum, reinstitute the information checkpoints at our largest land highway crossings and for domestic travelers returning at Richardson International?
Yeah, so again, I kind of alluded to this earlier. We're looking at every option on the table. There's lots of tools that we can utilize. I think the next several weeks is very important in the fight against COVID-19, with trying to keep case numbers down, keeping the impacts on the acute care system minimal, and having that vaccine rollout. That's really important in the ability of COVID-19 to generate cases that go into hospitals or ICUs. So every option's on the table, and we've done different things in the past, and we're going to continue to look at everything and even look at what you've sort of described. We've already have been talking about that. And again, when we come to a decision on where we want to go with this, that will be presented to everyone.
Thank you for that.
From the Canadian Press, Steve.
Hi, Dr. Atwal. Given the fact that some people are not following the orders, have you or other health officials recommended higher penalties, higher fines for those that break the rules?
We discuss things with our enforcement side on a regular basis. Again, nothing's off the table. I think we're really focused on getting enforcement more visible out there. We have orders. They're like signs in relation to speed limits on the highway. Once in a while there are officers there. Once in a while there is an ability to ticket somebody, and we're really going to focus on that. Regarding the actual, dollar amount attached to the fines, I think, again, anything is available to us to look at, and that's something we will look at as well.
So given the frustration, I would say, that you expressed at the start of this press conference with people who are gathering and people who are breaking the rules, what needs to happen in terms of getting more people catching the speeders out there?
Yeah, first and foremost, I really believe, and I feel and I see it, that most Manitobans are doing what we're asking them to do, point blank. But it can just take a handful of individuals, a small percentage of the population, to have these ripple effects on society. So we have the orders, we have messaging, we have enforcement, we've discussed things with enforcement as well. We're looking at everything that we can do to increase adherence, to get that buy-in from the public as well. We're pleading to individuals to talk to even your own family members. I'm sure people who know people in their family who aren't doing what they should be doing. Is it unreasonable to kind of point that out to them? We have orders that we can enforce with tickets. We are doing that. We're going to continue to do that. We're going to push that. So I think we're doing a lot of different things here. I think Manitobans, again, Manitobans are good people. And in general, if we ask Manitobans to do certain things, they're doing them. Sometimes, everyone does have a lax moment, or where they might have a slip up per se. Let's be really cognizant of that and make sure we don't slip up. Don't do those individual risk assessments thinking this is a low risk activity. Every interaction we do has potential risk. So really limit those interactions with individuals. That's the most important thing that every Manitoban can do. From an orders perspective, from an enforcement perspective, we are working with those individuals in government to make sure that that is out there, and that we're active in that as well, to ensure that those who aren't adhering are ticketed or impacted by enforcement.
Our final reporter this afternoon from CBC National News, Cameron.
Hi, Dr. Atwal, Cam McIntosh with CBC National here. To your knowledge, has Manitoba been approached by any other provinces to personnel, equipment, even vaccines to help in provinces right now that are experiencing higher caseloads than we are?
I have only heard something anecdotally, and I think that question is best posed to Shared Health or the Department of Health directly.
And it just, I detect an urgency in your voice here today. Over the course of the last several weeks, we've heard Dr. Roos and we've heard yourself talk about, keeping the variants back while we get the vaccine ramped up. Are we now at a point where it's no longer, reasonable to expect that we'll be able to vaccinate ourselves out of this, that the variants are here, they're in the province, that people that are thinking, oh, it's fine, the vaccine is here, do they really need to be rethinking that?
I would, as a blunt, I would say yes. We've got just over close to 250,000 people that say vaccinated. We still have a long way to go. We have variants of concern here. We have the UK variant that's basically becoming the dominant strain. That's going to have impacts as well. We need Manitobans to adhere to get more vaccine rolled out. There's not enough vaccine out to prevent a third wave at this point. We need those orders in place. We need Manitobans to adhere. We need Manitobans to step up and get that vaccine when their name is called, when their time is called. We are still a period of time away before we're vaccinating ourselves out of this. So we do have to be mindful of that. Yes, vaccines here. Vaccine supply is limited. We're getting vaccines out into arms as quickly as possible. Many Manitobans have already stepped up. Many more need to step up. With this UK variant, we're seeing younger individuals that don't have access to vaccine yet. And it impacts them much more profoundly than the original strain of COVID-19, and that impacts our acute care system. So we are a little too early for that. We still need to make sure that, we follow the fundamentals, stay at home when you're sick, get tested. When it's time for you to get that vaccine, adhere to the orders. That's going to be paramount over the next few weeks. This isn't a 1 or 2 day thing either. I'm going to be honest. This is going to be the next few weeks where we have to be really diligent here. We could see what's happening in other provinces and other jurisdictions, and we could see the impacts. So we really need to be aware. Let's step up as Manitobans, take a step back, and really monitor our interactions, stay at home, only go out for essential items, and really limit those interactions.
Thanks.
Thanks, everyone. This concludes our media briefing.